If you're watching this video, you or someone close to you might be undergoing a lower limb surgery in the near future. In this case, you deserve to know all about the possible risk of deep vein thrombosis, blood clot formation, during or after the surgery. First, let's make sure we know what deep vein thrombosis is and what risks it's posing. Deep vein thrombosis is the name for a blood clot that forms in the deep veins of the lower limbs. The clot often causes swelling and pain, can sometimes break away and travel to the heart and lungs through the venous system, causing pulmonary embolism, PE, another serious and potentially life-threatening condition that may lead to death or organ failure. Now, let's focus on what you should know about DVT and PE prevention treatment. In most of the cases, in order to prevent blood clot formation, you will be prescribed anticoagulants that compromise the body's ability to coagulate and by that substantially reduce the occurrence of DVT and PE. These drugs are taken either orally or by injection for a period of 10 to 30 days after surgery. What you should know is, studies have shown that up to 5% of patients taking anticoagulants will suffer from a serious bleeding complication. None wants to be within these 5%. Until recently, there were no proven alternatives, but now it has changed. Insist on the ActiveCare therapy treatment. ActiveCare is an FDA-cleared, non-pharmaceutical therapy that was proven in numerous clinical studies to be non-inferior to anticoagulants in DVT and PE prevention, without elevating the risk of serious bleeding complications. So how does it work? ActiveCare therapy works by gently applying compression to the patient's legs, increasing the speed of blood flow in the veins, reducing the risk of clot formation. Its portable size, lightweight mobility, and ease of use provides continuous 24-hour protection for the most safe and effective way to prevent DVT and PE. Now, let's take a look at the following comparison. It is important for you to understand the facts before you consult with your physician. Both ActiveCare therapy and anticoagulants are effective at DVT and PE prevention. They just work differently. While anticoagulants influence your body's ability to coagulate that help stop bleeding, ActiveCare applies gentle compression to your legs, increasing the speed of blood flow in the veins, by that reducing the risk of clot formation. There's a number of serious side effects caused by anticoagulants, while ActiveCare therapy has almost none. And finally, anticoagulants increase your risk of major bleeding complications while the ActiveCare does not. But that is not all. On top of all these advantages, ActiveCare also diminishing post-operative pain and swelling, reducing wound healing time, reducing edema. Consult with your physician about your option to use the ActiveCare for DVT and PE prevention with your surgery. You can also find a list of physicians using ActiveCare on our website at activecare.mcs.com/doctors.